Our overdose fatalities had a 36% rate of those people had been previously incarcerated. It doubled in 2021. 76% of the people who fatally overdosed had a prior incarceration history. So we were looking at that.
Welcome to Shooting Straight with Brad and David. I'm David Clouse, your Navajo County Sheriff.
And I'm Brad Carlyon, your Navajo County Attorney.
And this month we're joined with Ernie Garcia, Deputy Chief of Jail Operations for the Sheriff's Office. You'd think I'd remember that, right? And Don Wilson, our Director of the Navajo County Criminal Justice Coordinating Council.
Yes.
Thank you both for being here. And every month we always have a different criminal justice or public safety topic. And we're going to hit on one today that both of you have been working really hard on through the detention center. But Don, could you start us off? Tell us a little bit about the Reaching Rural project and kind of our viewers of what that is and how that helps the criminal justice system here locally.
Absolutely. In November of 2022, the Bureau of Justice Assistance created the Reaching Rural Advancing Collaborative Solutions Initiative. They chose 67 fellows from 26 counties, only 26 counties across the United States to participate. Well, Navajo County was one of those counties. So what this initiative did is it brought together rural practitioners of different professional backgrounds, and it helped to support them in addressing the challenges that we have in our counties with substance use. And we created a team, and we were able to fly across the country and interact with these 26 counties and find out what programs they had going to address substance use and mental illness and co-occurring disorders. And we talked about their challenges, their pros, their cons, and then it also helped us to address what our challenges are in our county. And then go ahead, sorry.
It was a year-long project, wasn't it, Don?
It was a year-long project, that's right.
And weren't each team supposed to come up with a new program?
Right. So we looked at some of the statistics we have in our county, especially what really we wanted to focus on was overdose fatalities. In 2019, we had our overdose fatalities had a 36% rate of those people had been previously incarcerated. It doubled in 2021. 76% of the people who fatally overdosed had a prior incarceration history. So we were looking at that. Then we were looking at, in 2021, we had 587 substance bookings that involved substance use. Even in 2023, it went down to 429, but that's not much. So we were looking at those stats saying, hey, we need to do something. We need to address substance use at an earlier stage. So we came up with our jail-based peer recovery support services program.
Before we get into what that is, who are the team members? You know, what different perspectives do they come from that you could get them all to agree that this was the right project to look for in Navajo County?
So one, we brought our grants manager on because our grants manager is the one who is responsible for writing these great applications, and we wanted him to understand what we had so that when we further go on, for other grants regarding substance use and stuff, we wanted him to have that knowledge. We had the health department. We had Lieutenant Peterson from our detention center, Sheriff's Office. We had community bridges. The person who participated from Community Bridges was Lonnie Young, and she's a peer. She's somebody that suffered from that.
All right, we keep using peer, and I think we need to define what a peer is.
So it's somebody with those same experiences, who have been there, done that. Somebody that can relate to somebody else, who's in the system, who's suffering from this, and they're more often willing to talk to that peer versus a deputy or versus someone else.
Somebody who's walked in their shoes and can better understand.
Right, and we also had one of our members from our Board of Supervisors, Supervisor Seymour, also attend. So that was our team.
So did you pick up the jail peer support project at the get-go, or is that something that developed over time, hearing what others were doing, looking at the data you talked about?
So we really had, one of our members from the health department was very adamant really about the overdose fatalities and addressing that issue. And so we all got on board after we met with other counties, and we kind of saw what they were doing, because several other counties were also doing jail-based programs such as this. They had different programs as well. They had other ones like recovery cafes and quick response teams, but this is something that really kind of hit home.
I was going to ask you a little bit about the overdose component of it, that she really wanted to focus on that part. Was that because of the high propensity of releasee or people that are released from jail to overdose? I mean, was that what she was focusing on, or just all overdoses across the county?
So if we can touch these people at incarceration at the time of booking, we can then support them throughout the jail process, and then we can continue to support them, this peer can, through their transition back into the community. Because a lot of people are forgotten. Once they come into jail, they serve their time, they're released, maybe they don't serve their time because they're released on bond, and they're right back into the community.
It sounds like we're getting into the program now as we're going to implement it. Ernie, when they come into your shop, your jail, what is the first part of that process for this peer network?
So the initial process is, as they're coming into booking, we have screening assessment tools that we're using so that we can identify those that are at most at risk for substance abuse disorder and treatment
and
overdoses.
And
which
that
goes back to the screening assessment tool that Dawn is talking about, which we're using to identify those that are most at risk of overdosing or have overdosed in the past. And as we're seeing, and Dawn has spoken to this, we're getting upwards of almost, and it's self-reported, but we're getting upwards of 40 to 50% of the population when they're coming in that are now talking
40 to 50%
now talking about having used prior or are using, and another 30% of those that are having overdoses, whether it's one or multiple. And we've got several that have come in that have had multiple overdoses.
I think I heard once one person self-reported 14 overdoses.
Yes.
And you're also tracking Narcan saves and hospital visits and all that.
Right.
And then I'm shocked every time Dawn shares those numbers. We knew that there was that was in the jail, but I don't think we knew it was at that level of that many time of repeat overdoses.
But remembering, those are self-reported.
Yeah.
And our numbers here in Arizona are still lower than what they actually are, because Narcan saves and stuff, they may not always be reported. If it's a group of people, drug addicts,
and there's those being booked or scared to admit they have it because they think it'll be used against them. So you're identifying them through the booking process. What's the next step for this program?
So we have reentry coordinators who work within the jail that work with the population to build a release program for all the individuals who are incarcerated that aren't going to Department of Corrections. So if they've been sentenced to county to serve time, or they're getting ready to be released after serving a couple of days.
So it could be just release pending their case working through the system.
Right. So what they'll do is they'll meet with those and coordinate care. So going back to what Don was saying is that we have a large population that walks out of the jail that just are released, and they're just turned over to going back to their own vices, and there's no one there that can hold them accountable for things that they have promised to do upon their release. So what the peer coordinators do is they actually sit down with these individuals and say, look, I've been in your shoes. I know what you're saying, and I know when you're saying that, oh yeah, I want to do it, but it's not because I'm truly there. It's just I'm giving lip service because I want to be released. I can understand that, but let's talk this through. I've been in those shoes. I understand what you're saying, but you're going down the path that I've been down, and it's not a pretty one. So they can get them to understand that, with the history and having that experience, they can touch on that, and it gives them credibility to get people to more commit to sobriety.
And I assume they also probably have a much better BS detector from those
Absolutely.
substance users. So you talked about a plan of care for when they're released. What is in that bucket for care? What are you talking about?
So it's a big bucket, and it comes with multiple parts. Our whole process we call the reentry coordinating service, but it could be medical care, it could be housing, it could be continuing with the peer mentors upon release. We've added another component within the jail. Not only do we have peer mentors, but we're also bringing in a remote peer mentor group that they'll be able to stay in touch with upon release, so that they'll have somebody checking up with them after release from custody.
So the peers in the jail are handing off these people to a peer outside the jail. Is that what I'm hearing?
Yeah,
from you?
It's a coordinated effort with our U-Turn company that's working with us remotely. So we have peer mentors working inside the facility, doing one-on-ones, being physically present. They're also working with coordinating that care with U-Turn. They're getting their counselors on the phone, and they're actually communicating with them through video service, as well as telephonic. And they follow them once they're released. They'll continue to follow them through this program with mentoring services.
Is there a cost to the county for this peer group?
So there is. We were able to secure a grant for over $400,000 that pays for this service to provide that mentorship in custody as well as outside of the custody.
It sounds like to get this together, you had a good group of 6, because you have public health that understands that aspect, somebody with the behavioral health counseling who's gone through it to really understand the services needed, a supervisor to help push it through the board of supervisors, a grant writer to help you get the grant, somebody from the jail that understands the operations. Was there anybody else that you thought could have added value to your group to give a different perspective?
You know, actually, the people who are directly impacted by all of the services that we're trying to provide would be an excellent component to add.
So somebody...
A peer for the peers?
Exactly.
Yeah. So a peer for this peer.
Somebody actually that has been through this process and understands how
not
difficult...
Not just this process, but the process in Navajo County.
Right.
So like they would serve almost as a consultant.
Correct.
Or an expert.
Mm-hmm. Different perspective. You're looking north and they're looking south, and see different things in the background.
Yeah, we can only see it from the outside. You know, none of us have actually experienced being released from jail and then having to, go back into the community and having to either go back to work or find a job just to maintain their life.
Or find a place to lay your head on that night, and how to get there. There's lots of times when I'm leaving the county complex in Holbrook and there's somebody with their little box walking down, then I see them with their thumb out on 77. But you've helped address some of that, haven't you, Dawn?
Absolutely. We've gotten, NACOG has provided gas cards and bus tickets. So we can do things during the day. We can do the gas cards after hours. Still wish we had more. I wish our transit system was a little bigger. We can't get anybody to Winslow.
But all that's helped coordinated through these peers in the jail now.
Mm-hmm. Yes.
So I just kind of ask you, I mean, we've really covered these things. What's the benefit? I mean, why do we go through all this effort? Why do we I know we know these things, but
saving
what is...
a life is number one.
Okay.
Reducing recidivism is another one. Reducing or mitigating the cost to the county, because there's a big
What kind of cost?
When they're incarcerated and they're mentally ill because they're self-medicating with illegal drugs.
Alcohol.
Alcohol is a big factor up here. Yes. There's several things that are a benefit to this, and we're turning these people into peers.
So, but you say there's cost savings. Are we tracking any data to see if this works, to see if it's worth the investment? I know we got a grant to get us going, but someday that grant will run out, and then our Board of Supervisors have to make a decision. Do we fund this, and what benefit do we get? Can we measure it?
Yeah, as we started building these programs, we're most of the grants come with a reporting mechanism, so we're able to take that type of information and then start tracking, what services we're providing and how that's impacting the communities as we're moving forward. And Don is absolutely right. Recidivism is the biggest one. If you look at the Pew Center, I mean, they put out data all the time, and one of the biggest information that I've been able to pull out of some of the Pew reports is recidivism in the nation is about at 44%, and that was in 2011 was the last one that they showed. So if you look at a jail and you say, let's just take ours, so we're averaging 280 to 300 people, so 44% of those are going to come back into custody. But to get into custody, they're going to impact somebody in the community. Someone, somehow, and it may not be somebody's house, it may not be somebody's car, but it's going to be services that they use, meaning they overdose. It's going to require an ambulance service, and what if somebody else is needing that service, but it's tied up? The ER room. There's so many different facets to criminology. It's not just how does it impact an individual on a daily basis, but how does it impact the community as a whole?
Society. Yeah.
Exactly.
And look at I always bring up the employment. I mean, the workforce. We need more in the workforce. If we just keep having the cycle, or if you start pushing out people that can fill vacancies.
And most of these recidivists with the substance use, mental health, tend to do the lower level crimes. Yeah. The ones that irritate everybody in the communities, including ourselves, right, but aren't our rapists, aren't our murderers. No. And those are the ones we really want to focus on. Mm-hmm. And if we can get these people out of the system, it lets you focus on those cases and the investigation. Lets my office put them in prison where they need to be for those serious offenses, and increases the quality of our communities if they're not recidivating and causing these community problems.
I love numbers, so if I can just give you something really quick. 15 counties in Arizona, right? We are in the top 5 for overdose. 47 out of 100,000 people overdose, not fatally. That's just overdoses.
That doesn't include the tribal lands either, I believe.
Right, so we're right in there with Gila County, Maricopa, Yuma, Pima, and Pinal counties. And those are in the 40s and the 50s, so we are right up there. And fatal overdoses, I know last year we had 30 fatal overdoses, and out of those 65% of them were prior incarceration history.
And this peer support program is just one small cog of what you, Ernie, and Sheriff are doing to try to help those that come through the system not come back. And unfortunately, we've run out of time.
Speaking of numbers.
Speaking of numbers.
I'll let you close it out, Sheriff.
Well, thank you both for joining us, and thanks for the great conversation and the great work both of you are doing to really make a difference with what these areas that Brad has pointed out in Navajo County.
And really making a difference to the citizens in Navajo County by increasing their quality of life, by helping reduce the recidivism rates.
Yeah.